Today, we will be presenting a health promotion education program focused on improving awareness, early recognition, and support for post-traumatic stress disorder among military veterans in San Diego. The presentation will discuss the target population, barriers veterans face when seeking mental health care, and the design of a trauma-informed educational intervention intended to improve mental health literacy and encourage help-seeking behavior within the veteran community. Our health promotion project focuses on trauma-informed mental health education and substance use prevention for military veterans in San Diego County who experience PTSD or other mental health challenges. We selected this topic because San Diego County has one of the largest veteran populations in the United States. Many veterans experience PTSD, depression, anxiety, and substance use disorders after military service, often compounded by barriers such as stigma, homelessness, transportation issues, and difficulty accessing care. Using a community-oriented nursing approach, this intervention focuses on prevention and health promotion at the population level. The goal is to improve mental health literacy, reduce stigma around seeking help, promote health coping strategies, and support long-term resilience among veterans. We chose this intervention because PTSD and related mental health conditions significantly impact veterans' health and quality of life. According to the United States Department of Veteran Affairs, many veterans experience PTSD during their lifetime, making mental health promotion a major public health priority. Using a community-oriented nursing approach, this intervention focuses on prevention and education. By increasing awareness of PTSD symptoms and promoting healthy coping strategies, the goal is to improve long-term mental health outcomes among veterans. This topic aligns with public health priorities and supports Healthy People 2030 mental health objectives.
My name is Patrick. So the intended learners are adult military veterans living in San Diego County who are experiencing PTSD or other mental health challenges such as depression, anxiety, or substance use risk. We're one of the largest veteran populations in the country due to a strong military presence, including Navy and Marine bases. The veterans are a visible part of this community. Our target population includes veterans from all service eras. While many have received care through the VA system, others may not be engaged in services due to stigma, transportation issues, long wait times, or difficulty navigating healthcare systems. We recognize that the veterans are diverse, so they can vary in age, gender, race, ethnicity, combat exposure, and social support systems. Some veterans experience housing instability or homelessness and can further increase vulnerability due to worsening mental health and substance use. They may or may not currently receive VA services. Because PTSD often co-occurs with depression and substance use disorders, our education intervention focuses on improving mental health literacy, promoting healthy coping strategies, and encouraging engagement with trauma-informed resources. Several important stakeholders are involved with this health promotion initiative. First, veterans, family, and caregivers are key stakeholders, so the PTSD affects the entire family system. Family members can often identify symptoms, encourage treatment, or support adherence to care. Educating families improves communication, reduces stigma, and strengthens support networks. Second of all, providers within the U.S. Department of Veterans Affairs are critical stakeholders. VA providers deliver mental health services, substance use treatment, and trauma-informed care. Our intervention supports and complements existing VA services by increasing awareness and engagement. Community mental health organizations and veteran services organizations are also stakeholders. These groups provide outreach, housing assistance, employment support, peer mentorship, and integration services. Collaboration increases access and continuity of care. Public health nurses and local health departments are stakeholders because they design and implement population prevention strategies. This aligns directly with the community-oriented nursing practice. So finally, peer support groups are especially important in veteran communities. Veterans often respond positively to shared lived experiences. Peer-led education services reduces stigma and increases trust. By involving these stakeholders, the intervention becomes more sustainable, culturally appropriate, and integrated into the broader community support system. Our intervention is a community-oriented mental health education program designed for veterans experiencing PTSD with mental health challenges. These programs focuses on trauma-informed education and substance use prevention. So rather than providing clinical therapy, the intervention promotes awareness, prevention, and early engagement with services. The program would be delivered through a small group workshops in partnership with VA facilities, vet centers, and community veteran organizations in San Diego County. It is culturally sensitive, strengths-based, and grounded in trauma-informed care principles, emphasizing on safety, trust, collaboration, and empowerment.
Desired health outcomes. Our outcomes are basically in two main categories: what we want to increase and what we want to reduce. We want to increase mental health literacy, the recognition of PTSD symptoms, use of healthy coping strategies, and engagement in trauma-informed services. And we want to reduce substance misuse risk and reduce stigma tied to help seeking. The bigger picture is that education can shift what people do early on before symptoms and coping patterns get more entrenched. Values and barriers considered. We took veteran values seriously when planning this. A lot of veterans value self-reliance, resilience, loyalty, and privacy. So we framed mental health education as strengthening functioning and readiness, not as a weakness. We also built around barriers such as stigma, mistrust of systems, housing instability, transportation challenges, and PTS symptoms like avoidance and hypervigilance. That's why the environment matters so much. Predictable structure, clear expectations, and the option to participate at their own comfort level. That helps people like veterans feel much safer. Assets and literacy considerations. We also looked into strengths, not just problems. Veterans often have resilience, discipline, and adaptability. Their peer networks can be a protective factor, and structured learning tends to work really well. For literacy, we assumed varied health literacy levels, and we also accounted for the fact that trauma can affect attention and memory. So materials are written around a 6th to 7th grade reading level using plain language, short sentences, and visual supports. Our goal is clarity, not medical jargon.
The most effective teaching approach for this population is trauma-informed and strength-based. Sessions are designed to be small group or peer-led whenever possible, as veterans often respond positively to share life experiences. We incorporate interactive discussions rather than lecture-style teaching. Real-life scenarios and practical coping strategies make the content applicable and relevant. Autonomy is emphasized. Veterans can choose how much to participate, and this reduces power differentials and supports trust. Overall, the teaching approach aligns with trauma-informed principles of safety, collaboration, empowerment, and cultural awareness. These barriers by creating safe, predictable environments and offering flexible participation. To evaluate the immediate effectiveness of this intervention, our group will use several short-term assessment strategies directly after the session. First, participants would complete a brief, anonymous post-intervention survey with 5 to 7 questions. This would assess knowledge gained about PTSD symptoms, treatment options such as cognitive processing therapy and SSRIs, and how to assess VA or community resources. Second, we will use and also include a short knowledge check with 3 to 5 simple questions to measure understanding of key concepts, such as recognizing symptoms and knowing when to seek help. Third, we will assess changes in self-reported confidence. Participants would rate how confident they feel in recognizing symptoms, discussing mental health concerns, and seeking services. In addition to written tools, we will evaluate engagement during the session by observing participation in discussion, peer interactions, and questions asked. High engagement often indicates psychological safety and relevance. Together, these immediate measures help determine whether learning objectives were met and whether the educational approach was effective. Long-term evaluation focuses on sustained impact beyond the initial education session. At 3 to 12 months post-intervention, we will evaluate whether there was an increased utilization of mental health services among veterans in the target population. This can include tracking referrals to VA clinics, community mental health providers, or peer support programs. Another important indicator will be follow-up appointments, attendance rates. Improved adherence may reflect increased trust and reduced stigma. We will also assess changes in attitude towards mental health care through follow-up surveys, measuring reductions in stigma, and increased willingness to seek help. If feasible and ethically appropriate, validated screening tools such as the PTSD checklist could be used to evaluate changes in symptom severity over time. Ultimately, long-term success will be demonstrated by improving access to care, sustained engagement in services, and improved mental health outcomes within the veteran community.
To ensure this intervention is successful, follow-up efforts must continue beyond the initial session. Collaboration with veteran organizations helps build trust and improve access to services. Peer-led support groups and accessible educational materials can reinforce learning and reduce stigma. Follow-up sessions at 3 and 6 months will help reinforce key concepts. Encouraging providers to routinely screen for PTSD supports early identification and treatment. PTSD continues to significantly impact veterans' mental, physical, and social well-being. Immediate and long-term evaluations help measure learning outcomes and community impact.